In July 2025, researchers published results from a clinical trial that read like science fiction. Children born profoundly deaf received a single injection into one ear. Within weeks, some of them could hear speech for the first time in their lives. The therapy is called DB-audio, and the results published in the New England Journal of Medicine showed that 3 out of 12 patients achieved normalized hearing sensitivity from silence to sound with one injection.
3 out of 12 achieved normal hearing. What happened to the other 9?
Nearly all 12 children showed clinically meaningful hearing improvements. The 3 who achieved normalized sensitivity were the standout results, but the broader group demonstrated significant gains in their ability to detect and respond to sound. A press release from Regeneron Pharmaceuticals, which developed the therapy, described the results as demonstrating clinically meaningful hearing improvements in nearly all children.
Okay, let me back up. How does a single injection restore hearing? What's actually happening at the molecular level?
The children in this trial all had the same genetic condition. They carry mutations in a gene called OTOF, which encodes a protein called otoferlin. Otoferlin is essential for one very specific job. It enables the inner hair cells in your cochlea to transmit sound signals to the auditory nerve. Without functioning otoferlin, those hair cells can detect vibrations, but cannot communicate what they're detecting. The machinery works, but the signal never gets sent.
So the ears physically work. The hair cells are intact, they just can't send the message.
That's the key distinction. In most forms of hearing loss, the hair cells themselves are damaged or destroyed. Once they're gone, they don't regenerate in humans, but in O2F related deafness, the hardware is fine. It's a software problem. One missing protein prevents the entire chain from functioning. That makes it an ideal target for gene therapy because you don't need to rebuild structures, you just need to deliver the missing instructions.
And that's what DBOTO does. It delivers a working copy of the gene.
The therapy uses an adeno-associated virus, or AAV, as a delivery vehicle. AAVs are viruses that have been engineered to be harmless. They can't replicate, and they've been used in gene therapy for decades with a strong safety record. The challenge with OTOF is that the gene is too large to fit inside a single AAV particle. It's one of the largest genes targeted by gene therapy. Regeneron's solution was to split the gene across 2 separate AAV vectors. Each carries half of the otoferlin coding sequence. When both vectors reach the same cell, the 2 halves recombine to produce the full-length protein. It's called a dual vector approach, and it was one of the major engineering breakthroughs that made this therapy possible.
They split the gene in half, loaded each half into a separate virus, injected both into the ear, and trusted that the 2 halves would find each other inside the same cell and reassemble?
And it worked. The dual vectors are injected directly into the cochlea during a surgical procedure under general anesthesia. The AAV particles infect the inner hair cells, deliver their genetic cargo, and the cells begin producing functional otoferlin. Once the protein is present, the synaptic transmission from hair cells to auditory nerves starts working.
How quickly do patients start hearing after the injection?
The results showed improvements within weeks. A July 2025 report from Science Daily described dramatic results just 1 month after a single injection. The children went from having no measurable hearing to responding to conversational level sounds. For the 3 patients with the best outcomes, hearing sensitivity approached the normal range within months.
What was that like for the families, going from your child being profoundly deaf to hearing your voice?
The clinical descriptions are measured and scientific, but behind every data point is a child hearing their parent's voice for the first time, hearing music, hearing their own name spoken aloud. These are children who were born into silence and are entering the world of sound at age 2, 3, 4 years old.
Is this only for children? The title mentions 20 years of hearing loss.
A separate study published by UC Irvine's School of Medicine in July 2025 expanded the findings to include adults. Their results showed that gene therapy for hereditary deafness is safe and effective in both children and adults. The adult patients had lived with hearing loss for much longer, and while the improvements were meaningful, the developing brain's plasticity gives children a significant advantage in learning to process sound after restoration.
That makes sense. A child's brain is still wiring up for language. An adult's auditory cortex has been quiet for years.
Precisely. There's a concept in neuroscience called the critical period for auditory development. The brain is most receptive to organizing sound processing in the first few years of life. Treating children early maximizes the chance that restored hearing translates into normal speech and language development. Adults can still benefit significantly, but the neural rewiring is more challenging.
How many people worldwide could benefit from this specific therapy?
OTOF mutations account for roughly 2 to 8% of hereditary hearing loss cases. That might sound small, but hereditary factors are responsible for about 50 to 60% of all childhood deafness. Globally, that translates to tens of thousands of children who could potentially be candidates for this specific gene therapy.
But OTA-off is just one gene. There are other genes that cause deafness too, right?
Over 150 genes have been linked to hereditary hearing loss. OTOF is just the first one being successfully targeted with gene therapy. The NIDCD, the National Institute on Deafness and Communication Disorders, describes gene therapy clinical trials as underway for OTOF-related deafness specifically, with research expanding toward other genetic causes. The dual vector approach that Regeneron pioneered could potentially be adapted for other large genes involved in hearing. And for smaller genes, single vector therapies could be even simpler to deliver. This is likely the first chapter, not the whole book.
What about safety? Injecting viruses into the inner ear sounds risky.
The Phase 1 HEAF cord trial was specifically designed to evaluate safety alongside efficacy. The AAV vectors used have a decades-long track record in other gene therapies. The surgical injection procedure carries the typical risks of cochlear surgery, including a small risk of balance disturbance. But the UC Irvine study specifically concluded that the approach is safe in both children and adults, with no serious adverse events reported that were attributed to the gene therapy itself.
Where does this go from here? When could this become a standard treatment?
DB-OTO is still in clinical trials. Regeneron would need to complete Phase 3 trials with larger patient groups, demonstrate consistent results, and receive regulatory approval. That process typically takes several years, but the Phase 1 half results are strong enough that there's genuine optimism in the field.
A child born deaf, a single injection, sound within weeks, 3 out of 12 hearing normally. And this is just the first gene, the first approach, the first generation of the technology.
5 years ago, restoring hearing in a congenitally deaf child was theoretical. Today it's published in the New England Journal of Medicine. That's the pace of gene therapy right now, all sources linked below.